Acne scars is another very disturbing problem with which patients present to us very commonly. Acne scars are basically the permanent marks in your skin which happen due to neglection of your acne, not taking proper treatment well in time. So over the period of time, what happens is that the fibers which give smoothness to our skin, they break down and leads to pitted or at times very fibrotic dense scars in your facial skin. So what we generally suggest to patients is that they should never neglect their acne, should never touch them or play with them, and they must consult the dermatologist immediately the moment they notice any kind of acne form eruptions on their face, because acne is something which is very easily and completely treatable with very simple medication without any cost even. But the moment you start neglecting your acne, that leads to problems, and acne scars being very disturbing such problem. But thanks to the available technology these days, we can also tackle acne scars to quite a lot of extent. We do have very effective treatments for acne scars in the form of a derma roller or a Dermapen treatment, and also a little more invasive a fractional CO2 laser resurfacing treatment. So I'll explain what is the difference between the two. Dermapen or a derma roller is basically a microneedling kind of treatment in which we use a pen-like equipment on your skin, which leads to a collagen induction in the deeper layer of your skin, in the deeper dermis, eventually leading to collagen induction as well as smoothness back to your skin. So we have to take a little more number of sittings in this case, which are once a month, and may continue for 10 to 12 sessions for almost 70 to 80% and even up to 90% improvement in your acne scars. It is a very effective, very safe treatment without any side effect, and also economical too in comparison to a laser treatment. Coming to fractional CO2 laser resurfacing, it's also an age-old treatment now with of course improvements in the technique as well as the reduction in the downtime, with improvement in this laser technology with every passing day. In the laser treatment, we need fewer sessions than a Dermapen. Of course, the sittings are lesser. We just need 3 to 4 sittings for a visible improvement in your acne scars at a gap of say 1 to 1.5 months time. And a good point in a laser treatment is that it also improves your upper skin. It would lead to almost the complete resurfacing of your facial skin with reduction in the blemishes, spots, superficial pigmentation, and along with the acne scar improvement, of course. So, but it also comes with the predictable side effects in few patients in the form of pigmentation. Of course, it is temporary, can be managed well, but yes, we need to inform the patient well before in time that of course that this is a possible side effect of a laser treatment. So that your dermatologist has to decide in which patient we have to use a Dermapen or in which patient we can safely use a CO2 laser, of course. So cost-wise, the CO2 laser treatment, of course, is a little more expensive than a Dermapen treatment, but both of these are highly effective and very result-oriented treatments. Another very common problem with which women walk into our clinic is the unwanted facial hair, which is also called hirsutism in the medical terminology. Unwanted facial hair is a very extremely distressing problem to the patient, but it has got multiple factors behind it, the most common being a polycystic ovarian syndrome, which is extremely common in this belt of the country. It is basically a hormonal upset, which is due to formation of small follicles within the ovaries, which leads to an elevation in your testosterone and decrease in your estrogen levels, due to which you have that male kind of hair on your face. At times, facial hair in women can be due to other reasons, like few medications, few drugs, some At times it can be even due to some tumors in your ovaries or anywhere else. And many a times it may be due to without any reason. It could be genetic also. So we have to basically work up the patient to find out what is the reason behind your excessive facial hair growth. So once we are sure of the reason, if at all we need some medication, we can start the patient on a medication so that the production of hair is decreased. And once we have achieved the normal hormonal status, then the best option to take is the laser hair reduction, which is a boon for patients like this. A laser hair reduction basically is a permanent targeting of your hair follicles so that they stop becoming active and they are miniaturized, and eventually your hair are reduced in both density as well as its thickness. We just need to have 6 to 8 sittings at a monthly gap, during which the patient will notice a very sequential reduction in the size, number, density as well as thickness of the hair. It's a very, very safe and effective treatment without any side effects or any kind of complications. We do have a nearly painless, fastest hair removal system at our center, which will help you get rid of your hair very, very, very comfortable manner.